You know, the Aboriginal people or the Torres Strait Islander people up in the north are completely different to the Aboriginal people here in the centre, and we're completely different to the people over in the west and south and east of Australia.
You've got some people in the community that practice more culture than others, and then there's the debate between whether that's more cultural or that's more cultural. So then we have to deal with that as well. So then it's like, that's the big mix of culture that happens.
You know, Aboriginal Arrernte people here might be very different to what Pintabee people would be like, or Ngunundjara people. You can't generalise.
Here to Papunya, they say it's equivalent from going from England to Germany.
When you don't have an understanding or a proper understanding of something, it's then easy to stereotype and make assumptions about people and why they're in the situations they're in.
Being aware of what your culture is and knowing what that is, so that when you enter into that cross-cultural situation, that you're aware of what your culture is and you don't take that in or push it onto someone else.
And even though if you're interstate person coming in here to work with us, they should learn our culture here.
We deliver an orientation, a cultural orientation, to our new employees here at Congress. The reason I call it an orientation is because we only do half a day. Everything we sort of do in it is scratching the surface, and the idea is to help or identify where I can scratch the surface for our non-Indigenous staff, so that they can go about then, you know, once I've scratched the surface, going about digging underneath then and then finding out what's there to be found out, you know, and learning a little bit more about people and culture.
But you also got to remember the cultural awareness training, who delivers it. Government kind of picks one person to deliver for the whole state, but that cultural awareness does not suit the country that we come from. And that's where you need to make sure that your cultural awareness is delivered by your local community, male and female.
To me, cultural awareness training is not just, as I was saying before, it's not just the training, it's about what happens after that. What's your commitment into the community around Aboriginal people? If
you're going out remote, is really listening to people, spend time talking to people, build relationships. People that are in a community just see non-Aboriginal people coming and going every week.
Anybody that's new, no matter if you're Aboriginal or not, there is that sort of hesitation of like, well, I don't know you, I don't want to go and talk to you about something that's really personal, but that's what you have to do. You have to make those connections first before you can do anything.
Get to know the people, actually believe the people. When they say something's not culturally right, but actually believe them and actually, you know, work with them and find out more about that.
When I go to a community or I'm running anything to do with sexual health in a community, the relationships that I've already built up and the community women I already know, would talk to them first and say, we do some education, where do you want us to do it, how do you want us to do it? And we would go out bush or go and talk somewhere, and I would talk with the elders first, talk to them about what we're going to talk about, what they wanted us to talk to the young people about, and who was going to be working with me.
It's like if you go to the communities and you work with the community, you would know what's appropriate and what's not appropriate.
You know, our cultures are based on gender when it comes to certain aspects of it, and sexual health is one of those things, you know, so you know, making sure that we have that right to begin with.
If you follow the cultural protocols, female with female, male with male, you will have no issues.
It's actually, it's basically not assuming and respecting people's wishes and not being upset if people don't want you to see them and not taking it as an offence one way or another.
I think it's about how you're responding to someone at that time. If they're being direct with you, well then obviously you're going to be direct back. If they're not being direct or talking kind of a bit sideways to start off with, then you need to respond in a sideways way. I think talking sideways is the hardest thing for people to learn when they're working in the clinic, to not be direct and say you've got an STI and you've got this, and because of that we need to have a HIV and a syphilis test and a Hep B test because you could get this. You've got to talk in a third person way and say people who have had this may get this, and then go around that way. To talk in third person, not direct. And even not looking directly at someone, look down at a piece of paper when you're talking.
Talk to people and actually find out what the locals want, rather than going in with your with all your knowledge as to what's right and what's wrong. Actually, you know, it's good to be aware of the different what people might want, but don't assume that everyone's going to be wanting that. I remember one of our female health workers, I said something about men's stuff, and she quietly pulled me aside and said, "You don't say that in front of any women anywhere."
If you're open and you're honest and you're telling the truth, there is this level where you can work it out. And if there is an issue, you're better off dealing with it straight away.
Oh, I mean, I've said, you know, words a couple of times when I shouldn't have, but people have always felt comfortable to come and tell me.
You know, having that open conversation about it and saying, hey, you know, this is what's happened, and the person receiving it should be receiving it as exactly that, a bit of education, a bit of knowledge around, you know, something I could do better later on.
It's one mess up, let's try to get back on track. This is what we do next time. If you do have any issues and you don't think it's right or wrong, talk to someone.
When they make mistake, well, it's good that we have a chat, you know, how that doctor can work along with that person next time round, he might do it better.
Community people, Aboriginal people and community are so forgiving.
Yeah, and I mean, the locals are very forgiving, I find.
When it comes to those things where people just don't want to acknowledge anything and just go about doing things themselves, and it's deliberately done, you know, that sort of approach, people just cut them off.
Because once the health service loses that trust and respect, it's gone, and it's very, very hard to get back.
Understanding each other's backgrounds, but also understanding that there are differences in culture and they do clash, and guess what, that's okay, you know, it's just the way it is.
I think you always have to remember that it's not your country and it's not your place. It's like you're walking into someone else's lounge room, so you need to behave the way that is courteous for that person's lounge room.
You know, how do I go about making sure I can walk around in their environment without breaching into their cultural laws?
You need to respect that other person and where they're at. So it's really about, primary health care is about meeting someone where they're at and working with them. It doesn't matter what context you're in.
You know, nobody works better than anybody else. We're all there for the same reason, for help, for the community and for the people in the community.